everyone. I'm here to talk about a virus that is more infectious than HIV, and that's hepatitis B. I think hepatitis B is a very interesting subject because it's still unknown to the general public. 350 to 400 million people worldwide are affected by this virus. They're chronically infected, and it takes a life every 30 seconds, and most of their lives are Asian. I chose this topic because I work in an immunization clinic. Also, a very good friend of mine is infected. He has an acute infection, and I have witnessed how much he has suffered. Today, I'm going to talk about what is hepatitis B, who can it infect, and how can we prevent ourselves from contacting the virus. Hepatitis B was discovered in 1965 by Dr. Baruch Blumberg, and he actually won a Nobel Prize for his discovery. There are two types. There's acute, which is a short-term infection, and it causes loss of appetite, pain in the muscle joints, stomach, tiredness, also yellowing of the skin and the sclera, which is the white part of the eye, and diarrhea and nausea. The second type is chronic, which the acute infection can lead into chronic infection. It is a serious infection that it can lead to liver damage or cirrhosis, liver cancer, and death. Although some of the people that are infected doesn't really have the symptoms. Hepatitis B is easily contracted through blood and body fluids such as vaginal discharge, semen, tears, also sweats. And it's not spread by kissing or hugging, sharing food or drinks, and also sneezing or coughing. It is important to know about hepatitis B because someone you know may actually have it. According to hepb.org, hepatitis B everyone is at risk for contacting this disease, but some of us are at high risk because of occupation and also life choices. Hep B can infect a baby whose mom is infected with hepatitis B. So the mom can actually pass it on to the baby through deliveries, regardless if it's C-section or vaginal. You can also get infected if you share toothbrushes or razors. Drug users who shares needles. Also individuals who have tattoos or body piercings unless they use sterile needles. International travelers who are visiting countries which hepatitis B is endemic. Those that practice unprotected sex or have multiple sex partners. Also healthcare professionals that get stuck by a needle, or if they have cuts, sores, and bites and blood, or they have direct contact with blood or body fluids. There is hope against this virus. Hep B is a vaccine preventable disease. There is a vaccine that is safe and ineffective, and it's a series of 3 doses. It is so effective that according to hepbfree.org, the CDC, which is Centers for Disease Control and Prevention, and also World Health Organization call hepatitis B vaccine as a first anti-cancer vaccine. So how can we prevent hepatitis B? So like what I said, vaccination. Also the baby, so after delivery, he needs to get a shot of hepatitis B immunoglobulin and a first dose of hepatitis B vaccine. Do not share needles and razors with people that are planning to get tattoos or body piercings. Make sure they use sterile needles. Use condom if you know when you're having sex. And for healthcare professionals and first responders, make sure you wear gloves and cover your cuts and open wounds. So get tested if you're exposed. If you think you're exposed, get tested. You can ask your doctor. Get vaccinated. It's offered in any clinics, your doctor's office. For those that have already been, you know, diagnosed with hepatitis B, there's no cure. But you can still enjoy completely normal lives. Take precautions to avoid further liver damage. No alcohol, no acetaminophen or any acetaminophen containing medications. Stay healthy, as decreased immune system can increase your chance of, can trigger the disease. Stay in touch with your doctor. You're supposed to get lab tests every 6 months and an ultrasound every year to make sure that to check if your liver has been enlarged. Spreading the word about hepatitis B to family and friends would increase awareness about this disease. There are many viruses out there that we don't know about. But as long as we can inform ourselves, we can help spread the knowledge on how to prevent all of us from contacting the disease. I hope you have learned about hepatitis B, that it can infect people, it can infect anyone. Everyone is at risk, and that, it's caused by a virus, and it can make you really, really sick and even cause death, and that we can prevent it by vaccination and also practice safety measures. That's it. Thank you.
Ako dahil pa meron, you have any question?
Hindi na.
Hindi para malaman.